Hello, it's Dr. Rhonda Johnson. Today is Wednesday, June 1st, 2022, and today I'm talking about long COVID ear disease. Now, most people know that COVID can affect other organs besides the lungs. It can affect almost all major organ systems in the body, including the blood vessels. That's why long COVID is not just one condition, but can represent over 200 different symptoms relating to damage to different organ systems. So today I'm discussing ear problems as a symptom of long COVID. But first, let's review what the ear does. The ear is involved with hearing and balance. Now, that SARS-CoV-2 virus, the virus that causes COVID, can and does enter the ear, probably through the eustachian tube, which connects the nose and the middle ear. Now, once it gains entry to the ear, it can actively infect the ear cells. They're hair cells that are involved in hearing. Those are called cochlear hair cells. And balance, those are called vestibular hair cells. And it can cause that inflammation of the eustachian tube that connects the nose and the middle ear. And that can become inflamed during the course of COVID and lead to middle ear congestion. Now, many people with Omicron in particular reported middle ear congestion and ear infections. Now, there are few studies that have documented the persistence of mild to profound hearing loss, vertigo, that's motion sickness, and tinnitus, which is ringing and hearing high-pitched sounds or like a whooshing in one or both ears, and people who have otherwise recovered from COVID infection. That's considered long COVID ear disease. Now, I want to also say that if you are experiencing any of these ear-related symptoms, I do encourage you to consult with your doctor or see an ear, nose, and throat specialist. Now, in full transparency, I want to report that both Pfizer and Moderna vaccines can trigger vaccine-related tinnitus in some people. In fact, the analysis that was done in March 2022 in the Annals of Neurology Journal, they looked at the VAERS, the Vaccine Adverse Reporting System, and they found that tinnitus was among the most commonly reported adverse neurological events following COVID-19 vaccine. So the bottom line, folks, is more research is needed before ear specialists fully understand how the COVID viruses or the vaccines can affect hearing and balance. All the research that I reviewed cite the need for high quality studies. But as I've said about other long COVID symptoms, it's not in your head. These symptoms are real and they may persist even after you fully recovered from COVID. As always, please take care, see your doctor, and be safe.